Good evening, Anne. I think we're good to go.
Okay. Welcome everyone to the fifth FAQ Live event in our series. Thank you all for joining us. That was Tracy Dolan speaking. We're really pleased to be with you tonight. I'm Ann Galloway, the editor of VT Digger, a statewide nonprofit news organization that serves Vermont. And it is my distinct pleasure to introduce you to Tracy Dolan, the Deputy Commissioner of the Vermont Department of Health. Tracy will be talking with us about the state's rollout of the vaccine, and she'll be answering your questions. And I have to say, there are a lot of questions, about 200 in all, sent by Vermonters who are concerned about how the vaccines will be distributed. We won't be able to get to all of them tonight, but we'll get to as many as we can. I want to thank Tracy again for taking time out of your busy schedule to be with us. And I wanted to mention that the Department of Health just announced that phase 5 of the vaccine rollout starts on March 8th. School staff, public safety employees, childcare workers, and more Vermonters with high-risk conditions over age 55 will become eligible for COVID-19 vaccination starting next week. The following week, people with the same high-risk conditions, age 16 and over, will become eligible. All told, that's about 75,000 people, according to the Department of Health, and over 100,000 Vermonters so far have received at least one dose of the vaccine. Tracy will help us understand how the phase 5 rollout will work, what health risks make people over age 55 eligible, and answer your questions. Before we get started, I'd like to thank Mike Doherty, the digital editor for VT Digger, who's producing our live stream tonight. I'd also like to thank the generous sponsor of the FAQ Live series, Garnet Health. Garnet, an integrated healthcare delivery company, offers COVID-19 testing at locations around the state and mobile vaccine administration. Garnet offers PCR and antigen testing with an emphasis on rapid results and efficiency for individuals, businesses, groups, including summer camps and events and weddings. Visit us at garnet.care to sign up for testing, or email inquiries at garnet.care for information on how Garnet can assist you. Tracy, thank you again for joining us. There's incredibly high interest in the vaccine rollout. Can you give us an overview of where we are now?
Sure, we're doing really well. Vermonters are doing great. We've already vaccinated about 100,000 Vermonters, at least with first dose. That's a big number. We had great turnout for 75 plus, 70 plus, and now we've opened up 65 and older. Overall in Vermont, our percent positivity, so the number of people who are positive among those who get tested, remains relatively low at 1.4%, although we still have plenty of viral activity in the state. We are averaging about 100 cases a day, sometimes a little more than that. And we know there are outbreaks, so we know it's still out there, but there's real hope on the horizon. We're getting more vaccine all the time. We heard from the Biden administration that they're expecting to really roll out a lot more vaccine now with the Johnson & Johnson vaccine. So overall, we're feeling good, but really encouraging people to continue to be cautious in this last stretch.
That's so great to hear. So the news today nationally was that there could be enough vaccine by the end of May. Do you think is that what you're hearing too?
That there could be enough vaccine?
For all adults, yeah.
Yes, and we were feeling that even prior to that announcement. So that's great to hear. Certainly our rollouts have been accelerating with more vaccine. We've got a lot of people registering and showing up. And our hope is that early summer, a vaccine will be ready and available for anyone who would like it in Vermont.
That's terrific. Could you talk a little bit about the people with high-risk conditions who will be eligible starting next week over the age of 55?
Sure. So the CDC recommended certain medical high-risk conditions to be prioritized. And when we say medical high-risk conditions, we don't mean conditions that you could have that make you sick generally, but these are conditions where if you had that condition and then got COVID-19, you could have a much more serious outcome, such as severe illness or hospitalization. So some of those conditions, and I urge people to go to the health department website to learn more, healthvermont.gov. Some of those conditions include current cancer, diabetes, autoimmune disorders, some immune suppression, pregnancy also as a condition, and some intellectual disabilities as well. And there are others on the list as well. So I encourage you to go to the Vermont Department of Health website to learn a little bit more about those conditions.
Great, thank you for explaining that. I wanted to turn to the questions that we have from readers. And the first one is from Liz in Greensboro. It doesn't sound like are you hearing that all right, Tracy? No, I'm not hearing it either. I'm going to go ahead and read this one.
Okay.
We are wondering what the next few categories will be and what the anticipated timeline is after the upcoming comorbidity category opens up.
Sure. So the high-risk condition category opens up next week. And as you know, concurrently, we're also working on teachers, so teachers and school staff in schools, and also Department of Corrections personnel and some public safety. But after our high-risk conditions and the two age groupings, we're not sure yet what the next group will be. We may continue to go down by age category. We may shift to some other kind of sector or group. Not certain yet. Our hope is that in the next 6 to 8 weeks, we're able to open up more broadly to the public. We may be able to do that sooner, but no decisions yet have been made beyond the high-risk group. And then with the other groups that were mentioned earlier this week with school staff, childcare workers, and corrections and some public safety officials.
So once all those people are vaccinated, how many people total? Will that be about 200,000? Is that right?
We're hoping, I mean, you know, ideally, if everybody who was eligible took it, we would hope it's up about that. It may not be. We don't always get 100% uptake. I think we've been getting at about 70% uptake, so it might be a little less than that. But if you look at the population of Vermont, I think it's about 630,000. And then you take out people 16 and under, which is about 20%. So let's say 125,000. That leaves us with just a little over 500,000 people. And so we've already vaccinated 100,000. So getting up closer to 200,000, hopefully we'll be, we'll be in that last section, expecting even if we were to get as high as an 80% uptake rate, we'd probably have, coming up close to half of Vermonters who are interested and wanting to get vaccinated, hopefully in the next several weeks.
Boy, that's real progress, isn't it?
Yeah, it really is. Yeah.
Menno from Manchester wants to know, how is the state confirming patients' pre-existing conditions?
Great question. So primarily when people go online to register, if they have one of the high-risk conditions, and again, the best way to check is to go to the Health Vermont website because there are more details there. I didn't mention heart disease before. Heart disease is also another category there. Check there to see if you qualify. And if you're not sure, you can check in with your doctor to see if your condition is the condition that you're reading, if you're uncertain about the terminology. But then you'll go on the website and you will actually get a drop-down menu that says, do you meet any of these high-risk conditions? If you do, there'll be instructions on either providing your doctor's name and phone number, or it's possible you will have some other kind of code that will let us know that you're already in some kind of data system with that chronic illness. It should be pretty low work on the part of the person registering, and we won't be confirming everyone. We'll probably confirm a sample of people. We're not sure how we'll do that yet, but if you provide your doctor's name and number and we need to confirm, we're able to do it. Again, the confirmation is less about excluding people, and it's more about just making sure that people with high-risk medical conditions are definitely getting prioritized and getting the vaccine that they need. We anticipate, like it's been all along, that Vermonters will participate in all aspects of the COVID response like they have with real enthusiasm. And there's real trust in Vermont. Even with our age groupings, people aren't showing identification when they show up, but people are still really following those age groupings, which is great. And we anticipate that the majority of people who sign up really will have these high-risk health conditions. So there's some confirmation, but I wouldn't get too hung up on that. If you have one of these conditions, you should definitely register, and we'll help you figure it out if you don't have everything that you need.
So honor system will work, is what you're
To some
saying.
extent, yeah, we will do a little checking. We just want to make sure that we're not too off in our numbers, because again, we only have so much vaccine and we really need it to get to the people who would have a severe illness were they to get COVID-19 with their underlying condition. So we will do some checking, but not certain if it will be on every person or it may be a little more on a sample basis.
Well, it looks like our audio might be working again. So the next question is from Robin of Burlington.
Robin from Burlington asks, will the state be issuing some sort of proof of vaccination card? And in what cases would it be used?
So people are actually getting a vaccination card when they go to get vaccinated. We're hearing from Staples and other companies that a lot of people are laminating their cards to hang on to them. We're not sure how it'll be used. I know the governor has suggested to have it with you, particularly if you travel. So right now in Vermont, if you travel and then you come back into the state, if it's been more than 14 days since the end of your vaccination, so your second shot in this case, then you wouldn't have to quarantine. And he recommends just having that card with you if you travel. But I'm not sure yet how we'll actually need to use it, but we recommend hanging on to it because there might be an opportunity to use it.
And that opportunity would be perhaps flying out of state, or do you have?
Could be.
Okay.
It could be related to travel either by our rules or maybe by another state's rules or even another country's rules. So very handy to hang on to. Yes.
A new kind of passport.
Yes.
We have a question from Claudia of Norwich.
Hi, my name is Claudia. I'm calling from Norwich. My question is about post-vaccination. After you've had 2 doses and it's been 14 days, like with the variants and things like that, how safe are you? Is it okay to go to church, go to public places, things like that? I'm actually asking on behalf of my parents who are in their 80s. They've gotten the vaccine and aren't sure about what is actually safe. Thank you.
That's a great question. Well, the nice thing about the vaccine is that it really does give you more freedom of movement and hopefully more peace of mind. It does offer quite a bit of protection, but it's not 100%. And so we still ask people to wear masks and to socially distance if they're going out into crowded places or if they're going to be near others. And so the vaccine, great to allow you to get out there, but again, and it's less likely that you will transmit. The information we're getting back shows that transmission is certainly reduced, but we don't know completely to what extent. And we do know that, of course, the vaccine isn't 100% effective. So that masking and social distancing while we wait for everyone to get vaccinated will still be important.
Do you think we'll be able to go without masks once everyone's vaccinated?
I think at some point you will see mask wearing reduced. It might become part of our culture in the wintertime during flu season when we're at a busy place, or some people might choose to keep it part of their culture, but it's certainly not just part of our culture, but required and important right now for the next few months. And then we'll see what it looks like in the summer. But I anticipate with more people gathering, because we may eventually, change restrictions a little bit, we're going to want to keep the mask wearing up, particularly in crowded places.
Good. We have a question from David in Perkinsville.
David from Perkinsville asks, there have been some comments that herd immunity will be effectively achieved with as little as 35% of the population having been vaccinated. Is that true? And if not, when can we believe we have effective immunity?
I think David said 35% to achieve herd immunity. I haven't heard that low percentage. I have heard percentages anywhere from 60 to 80%. Again, we don't have a clear number on it. We're really aiming for well above 50%, but I haven't heard anything as low as 35%. So stay tuned on that. And if we have more information from the CDC, we'll have that on our website. We're certainly aiming for as high a percentage possible.
What do you do if people don't want to vaccinate? I mean, what percentage do you anticipate will refuse to vaccinate for whatever reason?
You know, our healthcare workers right now are at, kind of 70 to 80%, but it sort of depends on the facility. We have some long-term care facilities that are lower, some that are higher. What can we do? There's not much we can do, but we can certainly encourage people. We know some lessons from other immunization programs like school immunization that we can send reminders, do more education. We learned from UVM that in order to make people more comfortable with vaccination there, they held town hall meetings with some infectious disease docs for their workforce so they can answer questions. And so we do know that there are things you can do, but ultimately, hopefully we're hoping that people make the best choice. I'm going to turn on my light here because I'm getting all dark and it's turning into a spooky show. There we go.
It's well, we have daylight savings next week, so the problem will be solved soon. We have a question from that sort of a follow-up on that, and it has to do with reaction to vaccinations. Is the state tracking adverse reactions?
We do. We track adverse reactions. Well, nationally, adverse reactions are tracked in a program called VEERS. And it's a national database. Anybody can put reaction information into it. And so a physician can record a reaction, an individual can, a family member can. So we are tracking them. And our numbers are very low for Vermont. I don't have the numbers right in front of me, but the number of reactions are very low. But we track it every week to make sure that we're on top of it.
So we have a question from Monica of South Burlington.
Monica from South Burlington asks, when will the one-shot Johnson & Johnson vaccine become available in Vermont?
That's a great question. We are receiving shipments, and we are expecting shipments to continue to come in from Johnson & Johnson. A lot of excitement about having this vaccine. The one shot is really advantageous to people who prefer one shot. We're thinking younger people might really prefer a one shot vaccine. We have been really lucky with people showing up for second appointments for the most part, but we do know through our other immunization programs that the more shots you have in a vaccine series for one illness, the lower uptake that you get. So the one shot is great. And it looks like there's a real commitment to amp up production of the Johnson vaccine too. So it gives us another tool in the toolbox.
That's great to hear. You know, a lot of readers have asked, can they choose which vaccine they can get? They'd like to know if they could get Johnson & Johnson over Moderna or AstraZeneca. So I don't know if you could answer that.
They can choose the time they want to get vaccinated. And then really it is what's the vaccine available. Dr. Fauci said the other day, the best vaccine is the vaccine that's available right now. And so if you're eligible right now, whatever vaccine you can get right now is the best vaccine. And we're really, because the first two vaccines, those percentages that came out, 95% effectiveness for moderate to severe illness, were so high. That was somewhat unanticipated. A lot of folks thought that the vaccines would have an effectiveness of 50, 60%, and we thought that would be good. And so relative to that, some of the numbers that came out for Johnson caused people to wonder. However, the Johnson vaccine, if you think of the endpoint, which is really avoiding hospitalization and death and severe illness, the Johnson vaccine is very effective at 85%. So it may be less effective at mild illness, but it's also just one shot. And so it's possible, Johnson is now working on the possibility of a booster shot several weeks later, even up to 8 weeks later or later in the year, that may be available to boost effectiveness there. But overall, all three are safe. All three are very effective at what we're really trying to prevent, which is hospitalization and death. And all three, are just really important to our whole effort and resources to keep people safe.
Well, that's great to hear. Is that true even with the new variants that we're seeing across the country?
With Moderna and Pfizer, during their development, we didn't have those variants, so they weren't able to test on those variants as much. With Johnson, it appears Johnson appears to be relatively effective against the variants. I can't speak to the percentages right now. In Vermont, we're yet to actually see the variant in one of our tests. We are doing some whole genome sequencing to look for it. We anticipate it's probably here. The good news, though, in Vermont is because our rates are relatively low, it will also tell us that it's likely that the presence of variants is relatively low. The way a virus mutates is through replication. It replicates when it transmits from person to person. Because we have relatively low transmission, as evidenced by relatively low cases, we don't have as many opportunities for the variant to also transmit. So really, the more that we do with masking, social distancing, hand washing, avoiding crowded places, the less likely that we will have the variant replicating in Vermont as well.
So we have to keep practicing the guidelines.
We really do, and I know it feels like it's just right, in reach, but there's still a few months that we have to do it, and I know we can do it. It's going to start getting warmer. People can be outside more. We know being outside is much safer than being inside in a group. So there are a lot of things that are hopeful, but right now, these last couple of months, especially inside, we've really got to continue this just a little longer because, wow, it could really shorten what we have to deal with if we can just keep this under control. It's going down all over the country, so that's good news as well.
It is going down. It's amazing.
Yeah.
Sue from Brattleboro has a question for you.
Okay, we have 2 questions about interplay between different states. On the one hand, Sue from Brattleboro, or in Brattleboro, is asking, I am a New Hampshire resident. However, I work in affordable housing in Vermont. Am I able to get the vaccine in Vermont because I am employed in Vermont? And on the other side of it, we have Alma from Westminster who asks, I live in Vermont, very close to New Hampshire. Can I get my shot in New Hampshire at Walgreens, or must I get my shot in Vermont?
So starting with the first one, you can get your vaccine if you work in Vermont in one of the eligible categories of 1A, in the healthcare or in school or in public safety. But generally, if you live somewhere else and you come here to work and you go home, if you're not in one of those systems, you can't get your vaccine in Vermont. If you get primary care in Vermont, but live somewhere else, you also can't get your vaccine here. That's been a shift that we've made because we don't have reciprocity with other states on this. So when we're vaccinating others and we're not getting it back on the other end, it's throwing off our vaccine numbers. So we've had to tighten up on that a little bit, unfortunately, and ask people to really get vaccinated in their state.
So if I could just ask you to clarify, I think what I heard you say was that if you live in New Hampshire and your primary doctor is in Vermont, you can't get the shot in Vermont.
That's right. You'll have to get it in New Hampshire. That's right.
Okay, very good. That is slightly different from.
Yeah, that's a change. And that's a pretty recent change based on what we were realizing was happening with other states and realizing the impact it has on our vaccine allocation. Yeah.
Great, thank you. We have a question from Catherine of Essex.
Catherine from Essex asks, have any vaccines had to be discarded? How is the state tracking how many each program gets and how many people were vaccinated? And if there were any left over that day that had to be discarded because someone missed an appointment or refused offer or the vaccine timed out. Has this happened? I'd hate to see even one shot wasted. Thank you.
Yeah, that's a great question. So in any immunization program, there's always going to be some wastage. Not intentionally, of course. Sometimes a vial might be dropped. Sometimes a vaccine might be spoiled because a refrigeration unit doesn't work properly. There can be reasons. The CDC has a general standard that says your vaccine wastage rate should be below 5%. In Vermont, we are well below 5% in any of our programs, but particularly for COVID, because we know how precious every vaccine is, we're well below 1% on wastage. But it is things like a vial is dropped or we may have wastage here or there. Occasionally, it might be that there were cancellations and the vaccine has been out too long now, but we do have a lot of measures in place to monitor this. So if we see a site that seems to have higher wastage than we'd expect, and again, these are all very low, even when I say higher, they're well below the CDC maximum recommendation. But if we do see it going up a little bit, we'll reach out and find out what's happening there. And we do have a protocol that at the end of the day, if people did miss appointments, we have steps folks can go through to make sure that we get those vaccines into arms. And in most cases that works. But there's always a little bit of wastage, but our goal is to have very little.
Once the Johnson & Johnson vaccine is available, will that solve some of the wastage issues?
I'm not sure about that. We'll still have probably, because human beings are human beings, so we'll probably still have a little bit, but again, it's very, very small. We're talking, under 1%, and for some sites, 0% or 0.001%. So really small numbers overall.
Good. We have a question from Deborah in Rutland, who says her mother is homebound in West Rutland, and she wants to know if there's been any progress in determining how and when homebound people without outside services will start receiving COVID shots.
Yes, we're working with hospitals and primary care to see who they've got on their rosters for homebound. Basically, if you're homebound, you probably get healthcare from somebody. So if you don't get it from a home health agency, you probably get it from a hospital or some other primary care provider. And if that's still not the case, you can call the Area Agency on Aging and provide them your information. We're hopeful that we're going to have a number that you can call if you're still not in any of those categories. We don't have that phone number yet. But in the meantime, if none of those agencies are associated with you, and we define homebound as someone who's unable to leave their home for health services, so that all their current health services come to them. If that's your case, call up your Area Agency on Aging. If none of the other services are connected to you, of course, and you can give them your information.
That's great to hear. I think we have time for one more question. We've had several people write in and complain that Walgreens has been scheduling patients for their second Pfizer vaccine 4 weeks instead of the recommended 3-week interval. And people are really worried about that. And I wondered if you might be able to comment.
Sure. We've been working with Walgreens on their second appointment scheduling, but overall, while the general recommendation is 3 weeks or 4 weeks, depending on your vaccine, I believe for Pfizer, it's 21 days. For Moderna, it's 28 days. You're okay if it goes a little beyond that. Those are the schedules. However, we recognize, for example, somebody could be sick on that day or have something else going on that day. And so even if it pushes out up to 10 days, it's still really the same kind of effectiveness. So not ideal, but we're not too concerned about a 1-week variance.
Okay, that's good to hear. Okay, I think we can squeeze in just one more question.
And can I quickly go back to the high risk conditions, because I was sort of saying them off the top of my head and I wanted to be a little more clear. Can I do that?
Absolutely.
So the high risk conditions that would qualify you for the phase that opens next week, first for 55 and older, is current cancer, chronic kidney disease, COPD, including emphysema and bronchitis, chronic bronchitis, heart disease, immunocompromised, so a weakened immune system due to solid organ transplant, blood or bone marrow transplant, or HIV with a low CD4 cell count. There's some other details on the website there. Severe obesity, which with a BMI of 40 or above, pregnancy, type 1 and type 2 diabetes, and sickle cell disease, and finally disabilities, including chromosomal disorders such as Down syndrome or intellectual disabilities.
Thank you for reading that out. That's
yes,
very, very important. I know we're at time, but there's one quick question I know you could answer probably in seconds, and that is from Connie on YouTube. What about vaccination of children? Is that going to happen in the near future?
Someday, not probably the near future, but they're certainly doing trials on children. And as we've seen, things can turn around pretty quickly. So they have been conducting trials with children for a while now. And so we're very hopeful, but not anytime soon. The good news is, though, the more of us that get vaccinated, the more we cocoon those kids so that they're less likely to get it. But no, we don't have the go ahead on that yet.
Well, okay. Thank you so much for all this great information, Tracy. I want to thank our sponsors of the FAQ Live series, Garnet Health. Garnet, an integrated healthcare delivery company, offers COVID-19 testing at locations around the state and mobile vaccine administration. Garnet offers PCR and antigen testing with an emphasis on rapid results and efficiency for individuals, businesses, groups, including summer camps and events and weddings. Visit us at garnet.care to sign up for testing or email inquiries at garnet.care for information on how Garnet can assist you. Tracy, thank you so much for taking the time to be with us. I know you are incredibly busy. So, thank you for answering our readers' questions, and we hope to see you again very soon.
Thank you, and thanks to all the Vermonters for participating in our response and working so hard to keep us in a relatively good place. We appreciate it so much. Thanks.
Thank you. Take care.
Bye-bye.